Good to see you up there. We are here once again, meeting in person in the Connecticut State Senate. Of course, the House of Representatives met yesterday to debate the governor's request to renew the declarations of both public health and civil preparedness emergencies beyond the current expiration of September 30th, and as was mentioned, through February 15th of next year. This will be the sixth such extension, and as was also mentioned, it will bring us to nearly 2 full years of this emergency status and nearly 2 full years of greatly expanded executive authority under Governor Lamont. I want to start my comments today, Madam President, by asking my colleagues in both parties to consider that they are voting here today not as Republicans and Democrats, but as senators. Senators that need to reestablish our place as a co-equal branch of our state government. This vote is required today because of Special Act 21-5, which is sadly the only real check on the governor continuing to run the state under these emergency powers and with greatly expanded authority. As a check, sadly, it's wholly inadequate. Instead of enabling the majority to either confirm or deny actions that the governor takes, I believe that this vote should be nonpartisan. While it's an improvement over simply allowing the governor to continue to renew his executive orders without any check at all, we can see that this vote is going to defeat its own purpose merely because the majority happens to be in the same party as the governor. And even if that was not the case, you would see that it would defeat its purpose by being an unfair check on a governor of an opposing party. You would think, Madam President, that since we are discussing something so important and something that is truly nonpartisan, like the state of emergency that our state is supposedly in, that we could come up with a way to do that in a nonpartisan fashion. But I'll take it because it's all I've got. And because it gives me this opportunity to speak to my colleagues today and to the people of Connecticut. The law itself that governs the public health and civil preparedness emergencies is so poorly conceived. It basically says that one person, in this case, Governor Lamont, can, based on his own opinion, declare an emergency and then grant himself expanded powers. And he can do so basically anytime he chooses. I wonder, since COVID-19 is no longer even close to the leading cause of death in this country, it's way behind heart disease and cancer, and I've even seen that it's behind Alzheimer's, a disease that inflicts older people at this point. Does that mean that the governor will be able to declare emergencies for those things? I don't know the complete legislative history that brought the law that governs the emergency powers to us, but it's a law that definitely needs to change, and I will be taking a very hard look at it next session. Madam President, I'm going to make the case today that we are absolutely, positively not currently experiencing a public health emergency in the state of Connecticut, and that there is no legitimate or compelling reason to grant this extension. In fact, I would go so far as to say that claiming that we are in an emergency state shows a shocking disregard of the facts, the intent of our laws, and it is an insult to the intelligence of every citizen in the state of Connecticut. Now, that's not to say that COVID-19 is gone. I'm not claiming that. I know there's a lot of people who want to dismiss any argument to the contrary that that person is a COVID denier or they're an anti-vaxxer or something like that. I'm not saying that at all. COVID-19 is not gone, and we should not abandon efforts to mitigate its impact. I'm just saying that we are not in a state of emergency. Instead of extending this emergency, the governor should declare an end to it. He should rescind his emergency powers, which I believe is his option at any time, and I believe it is his obligation at this very moment. I've been calling on him to do so for months, and any person who is looking at the actual data honestly and objectively would agree. Incidentally, this argument hinges on the notion that we are in a state of emergency. So let's talk for a moment about what that means. What is the definition of emergency? Merriam-Webster says that an emergency is an unforeseen combination of circumstances or the resulting state that calls for immediate action. The key words there are unforeseen and calls for immediate action. Neither is the case today. No one can claim today on September 28th, 2021, that COVID-19 is unforeseen, nor does it call for immediate action. The actions by the governor all along have been done as policy decisions. They have been procedural. They have not been reactions to an emergency. There's no sending fire trucks. There's no sending the National Guard. There's no response to something that is happening right here and now that needs to be addressed. The vaccine mandate that went into effect yesterday was issued actually back on August 19th to take effect yesterday. And then it was modified again on September 3rd. The point is that we could have and should have come in here any time between then and now to vote on whether that is good policy for the state of Connecticut. To say otherwise is simply untrue. As I mentioned, we are going on nearly 2 years of dealing with the coronavirus. The whole country, no, the whole world has been dealing with the coronavirus for 2 years. Some countries like Norway and Denmark have declared the pandemic to be over, and they are going to treat it similarly to the flu. Policies and procedures have been evolving over these last 2 years since the beginning, and they will likely continue to evolve for years to come. I want to take a moment and remind everyone how we got here. I remember President Trump and Vice President Pence coming to the podium, watching on the news, I think it was sometime in the afternoon, and they were clearly scared. You could see it in their faces. After all, the virus at that time was completely unknown. It was completely new. They had no idea how bad things were going to be. They even said that there was a possibility that millions of Americans might die. Indeed, it was a scary time for all of us. That was definitely an emergency. It's also worth noting that even under those circumstances, they didn't begin by mandating anything. They recognized that they were speaking to free citizens in America who have natural rights. They recognize that the government works for the people and that the government's job is limiting to educating and informing those people so they can make their own decisions. So they asked, not told, they asked us to help slow the spread by staying home as much as possible for the express purpose of what they called flattening the curve to prevent overwhelming the hospitals. And that was the purpose, Madam President. That was the emergency. How can we avoid a situation where our hospitals will be overwhelmed and we have enough doctors and so forth to address the pandemic? Since then, much has happened. We have collectively learned a lot about how to treat the virus, how to slow the spread, and now we have several vaccines that are widely available and widely administered, especially here in Connecticut. The governor likes to take credit for being near the top of all 50 states in the number of vaccines administered. And we could talk for a while about the myriad of other treatments and science that we know now that we did not know 2 years ago. And of course, as I said, the problem is not gone. We are still dealing with it. And from many accounts, the coronavirus may never be gone completely. And we will have to continue to address it like we address a lot of other medical conditions, viruses, and so forth. What is gone, however, is the state of emergency. A key argument that is being made by those in favor of the proposal before us to extend these powers is that the governor needs this to act swiftly. Madam President, that is simply not true. Those who are saying so are not being honest with the people of Connecticut. This body can act swiftly if need be. We've proven that time and time again, but that's not even the point. The point is the governor is able to declare a state of emergency anytime he wants, and it is immediately effective. So if this were to expire today, and there was an emergency that cropped up a week from now, a month from now, a year from now, he could declare an emergency at that moment, and it is effective right then and there. Of course, there are checks to prevent that from going forward without the consent of the legislature, but it is effective immediately. What we are witnessing with these endless extensions is unnecessary, and I believe purposely deceptive on the part of everyone involved. Senator Kelly mentioned the people's voice. The people need to be part of this conversation. The reason why we passed Special Act 21-5, which is the reason why we're here, able to vote as a check against the governor's extension, was to make sure that everyone in this chamber can continue to do our job. And our job is to act honestly and responsibly on behalf of the people that we represent. Those 3.6 million people in Connecticut, our constituents, the people that we promised that we would fight for, continue to be wrongly silenced to this day. And they will continue to be wrongfully silenced if this vote passes today. I will also say that any senator that votes for this extension is telling their own constituents that their own voice is not needed to make policy for this state. That is unacceptable. And I am shocked that something so key to our American system of government, our system of representative government, could fall along largely party lines. But I do want to say thank you to my colleagues in both parties that will do the right thing today. Recently, I sent a letter to the Commissioner of the Department of Public Health asking for the information that we would need to make an informed and educated vote today. And I was very surprised, pleasantly, that I did get a response, but I was a little surprised by some of the answers. Some of the questions that I had asked them were all about whether or not we could conclude that we are in a state of emergency. So I asked, what is the data for the basis of the conclusion that we are in a state of emergency? How has that criteria changed over the last 500 or more days? And what are you relying on to conclude that such an emergency still exists? I think it's very telling that the response I got from the Commissioner of the Department of Public Health is simply that, quote, the determination that an emergency exists rests with the governor. Like I said earlier, no science required, just one man's opinion. So I asked, do you know what criteria the governor is using or has relied on previously? And they simply said that they provide him with the same exact information that they provide the public via the COVID-19 data tracker website. So I want to talk about that data for a few minutes. And incidentally, for anyone watching, it's very easy to find online. You just type in CT DPH COVID-19 data tracker, and that'll probably bring you right to the same page that I am referring to. As I have been reporting for months now, based simply on the current number of hospitalizations and deaths arising from COVID-19, there is no current emergency, and there has not been for a long time. In fact, I don't believe there has ever been a point where the legislature could not meet to make policy for the state. And the proof is partly that we have been meeting. I heard mentioned in the House numerous times yesterday that we're letting the governor take over the state and everything else. And that is partly true when it comes to the management of the supposed emergency. But I want to remind everyone that we had a full legislative session in 2021. Almost 300 bills were passed out of both chambers, including multiple special sessions, plenty of them having absolutely nothing to do with the pandemic. We came in to talk about police accountability. That's one example. No one, not the legislative leaders, not the governor himself, can claim we were unable to conduct business even at the worst of times. In July, when we last met to extend the governor's powers, he expressed his desire to pass 11 particular executive orders. And he gave them to us. We had them in our hands. We could have and we should have voted on them when we were here. And we have that exact same situation today. The governor is telling us what he plans to do, and we are here in the building, able to discuss, debate. So let's debate and vote on each of these items. I understand that there is a process that allows for the legislature to revoke or veto, essentially, any of the executive orders that are passed by the governor if they choose to. So I'm calling on our legislative leaders, if they want to do what's right by the people of this state, to use that mechanism to call for a vote on every one of them. There is nothing stopping us from operating as our Constitution provides for, with a true representative government. As a state senator, I took an oath of office to represent and be the voice of my constituents. And that voice has effectively been silenced for the last 2 years, and on false grounds. Suffice it to say, if malls, liquor stores, restaurants, bars, snack shops, beaches, if all those things can be open and operating, then so can this legislature and the people's representatives. Another reason to point to that we are not an emergency is that very, very few states nationally continue to operate under states of emergency. When we were here the last time in July, I believe out of all of the New England states, it was only Connecticut and Rhode Island. So not even New York, not even Massachusetts, they continue to not operate under states of emergency. How is it possible that we can be in a state of public health emergency and Massachusetts and New York are not? Something must be different, right? Nope. I asked that question of the Department of Public Health also. And they said, quote unquote, our neighboring states are experiencing similar public health conditions arising from the COVID-19 pandemic as Connecticut. This highlights that given similar circumstances, other states seem to have a very different opinion on whether or not a state of emergency exists. I asked people listening to take a look at that data tracker website, and I want to just share with you the information that I grabbed off it, mostly Friday, although I did take a quick look at it yesterday also. While every death is tragic and significant, it's worth noting that they don't even bother to report the daily deaths anymore because the number has dropped so significantly. But as of Friday, there were only 282 people hospitalized in the entire state of Connecticut with COVID-19 in a state of 3.6 million people. And I understand that if you look at that today, you'll see the information from yesterday afternoon, which shows it has dropped to 264 people. This by itself is proof that we are not in a state of emergency. It also shows that out of the 2,003 cases that they are indicating in the last 7 days, about 1,300 of those are not vaccinated, which means that 34% are vaccinated and 66% are not. But honestly, that's the story, that 34% of those folks are vaccinated. That doesn't even make sense to me. That should and could raise questions for many, many people. On that same page, they show you how many cases there are. And it says something around 11 million tests have been provided. And they have cases listed as 387,000 as confirmed and probable. But I just want to point out for the people listening that that information is almost useless. I asked the Department of Public Health about this, saying you have 11 million tests, but the state is only 3.6 million people. But they repeated to me several times that they do not count people as a case more than once if they test positive multiple times. And I followed up that question just to make sure, but they said that DPH does not even keep this data. So I don't know whether that information has any value or not, but it's not really important. We're going to talk about the information that is important in a moment. But I bring this up because this is the information that is being shared each day by the administration and being put out into the news media for people to rely on to determine whether or not we are in a state of emergency. But it's confusing and it's inaccurate. I also asked the Department of Public Health, what does it mean when you say COVID cases confirmed and probable? And they said, quote, probable means that a patient is experiencing symptoms of COVID-19 or has significant exposure to the virus, but a test has not confirmed the diagnosis. Yes, ladies and gentlemen, that means that they are including people who were not even tested as cases. And I'm not bringing this information up to embarrass anyone or anything. I'm just pointing out that this information, if it is going to be used for something so significant as determining whether or not this body should meet to make the laws for the state, ought to be something that's reliable that we can all point to. An even better example of what I consider to be a useless and even phony number is the daily positivity rate. So Friday, it was at 1.88%. But what does that even mean? On one hand, you have the governor taking credit for having the lowest case rate in the nation. But think about this for a second. All this means is that they had a group of people that took a test, and so many of them came out positive. And on the next day, they had a different group of people who took the test, and a different percentage of them came out positive. What if on the first day, the people they were testing were showing up to hospitals with symptoms because they were sick? And on the next day, the tests that we are counting are people that need to get a test for their job or because they need to get on an airplane. This is a completely unreliable, it's a phony number, ladies and gentlemen. It doesn't really mean anything. If you wanted to actually determine the case rate is 470 positives out of a state of 3.6 million people. That is your case rate. And if you're going to at least attempt to be honest, knowing you cannot test the whole population, try and do it in a format that makes sense, a format that actually allows you to check it in a consistent basis by having a standard demographic or something of that matter. I also asked the Department of Public Health about the tests that are being administered, because I get emails day after day from constituents concerned about the tests, knowing that many of them have been removed from the FDA's approved list, and they are known to have many false positives. But it was clear from my answer that they did not have this information. Incidentally, the Department of Public Health pointed me both to the Connecticut Hospital Association, to the governor himself, to HHS, and to the Office of the Chief Medical Examiner. And I contacted all of those parties looking for information, and I'm going to share all of the responses that I got online at some point later today, because I believe people deserve to know that they didn't really give me any answers. They just kept pointing the finger back to one another about this is where you need to go look for that information. On the data tracker website, if you look at it, there's this blue graphs. I know we're not supposed to use any props in here. I didn't intend to have anyone really looking at the document other than to be able to find it on the web page, that it's the chart that shows the blue graphs. This is a very interesting chart because it tells us how many cases there are based on age groups. It's pretty astounding stuff. From 0 to 9, they show 26,000 tests. From 10 to 19, they show 46,000 tests. 20 to 29, 68,000 tests. 30 to 39, these are cases. These are positive cases, by the way. I'm sorry, not just tests. 30 to 39, 60,000 cases. 40 to 49, 53,000, and so on. Huge numbers. I think designed to really put fear into people. I cannot believe there were 68, almost 69,000 worth of cases in Connecticut for 20 to 29-year-olds. But if you click the drop-down box and you look at the associated number of deaths, again, confirmed and probable, you find out that these numbers are relatively low for anyone under age 60. For 0 to 9, 1. For 10 to 19, 4. And again, I don't mean to minimize any of these. Each one of these numbers is a person. And every loss is a tragic, tragic loss. But these numbers do not represent shutting down the state and this body. For 20 to 29, remember a moment ago I said 69,000 cases, 11 deaths. 30 to 39, 47, and so on. Obviously, the number goes up substantially when you get into people over 75 years of age. But for people under age 60, the number's relatively low. This essentially illustrates the danger to older residents, though most of those are related to individuals that have significant comorbidities. And I wanted to know how many of these healthy people are included in this list. Like of the 0 to 9, it shows 1 death. Of the 10 to 19, there are 4 deaths. So I asked for that information because I think it makes a really big difference when we're talking about school-age children, whether or not the deaths that are attributed to COVID were really attributed to COVID, number one, or whether these were healthy young people that we're talking about or not. And unfortunately, that is information I was never able to obtain. I did not get that from any of the parties that I asked, despite significant efforts. Just a reminder, that also means that the governor does not have that information either. So how, again, is he determining that we are in a state of emergency with such speculative and incomplete data, especially when it comes how to treat the school-age population? If we simply use our common sense, we have to rely on just what we absolutely know for sure. And that is that there are statistically few deaths below age 60. And if you add up all of the deaths on these blue charts for under 60, there are 710 total. That is the total number of deaths in Connecticut with COVID-19 probably since the beginning of the pandemic nearly 2 years ago. Again, that's in a state with 3.6 million people, and there is no indication of the status of their comorbidities. Again, every one of them a tragic loss, but 710 below age 60 individuals in the state succumbing to COVID-19 does not present something that prevents this body from doing its job. What we also know for sure, Madam President, is that we are not overwhelming hospitals and staff. As I mentioned, I asked this information of the Department of Public Health, and they pointed me to HHS. And I printed out their report from their website, which shows that as of September 27th, yesterday, they say 302 hospital beds are in use, even though the state website is now at 264. But at 302, that means that we are utilizing 3.61% of inpatient hospital beds for COVID-19. Just 3.61%. This also, by itself, is proof that there is no state of emergency. These are just facts. I'm not opining here or spinning as we witness every day from the governor and some members of the media. I remind everyone that we are obligated to do our jobs based on reliable information. And this, what I just shared with you folks, is the information. This is it. And remember, this is the information the DPH says that they provide to the governor himself. Today's vote is based on just one question. Is there a genuine public health emergency today that requires the legislature to transfer much of its lawmaking authority to just one person? Let's add to these facts the almost daily hypocrisy from Governor Lamont himself and some other noteworthy politicians across our state. Even they do not believe that we are in a state of emergency. Like bragging about how we have the highest percentage of vaccinations across the country and taking digs at other red states like Florida, who upon examination have pretty much the same kind of data and information and results that we have. Or like leaving the decision whether or not individual towns should mandate masks in their municipal buildings. Is that something that you would actually do in a real and true emergency? Or attending event after event, campaign fundraisers with no masks and little indication that we are in any kind of emergency. Take a moment, if you will, to consult Governor Lamont's own social media accounts on Facebook, Instagram, Twitter, and so on. There are photos upon photos over the last year, and even within the last week, with no masks, indoors, taking credit for how great things are. He appears to have a case for masks for thee, but not for me. A little older, but still relevant, there's a video clip from May 28th of this year. Not that long ago. This is Governor Lamont. This is great. I mean, I've spent the last year plus saying, stay safe, stay home. Today, I'm telling you, get out of the damn house. Come enjoy Hartford. Get on a plane, visit a restaurant, go to an amazing hotel. This is a time where Connecticut is open, ready for business, and we want you coming back. Does that sound like someone who believes Connecticut is deep inside a public health emergency? Incidentally, how about the Big E, Governor? Did you enjoy? I saw dozens of photos online of you in the Connecticut building, a crowded mass of people all wearing masks, but you weren't. One of the more bizarre things I have seen is photos of various campaign fundraisers and the such with speakers coming to a microphone with no mask, but there's a microphone or a mask on the microphone. I asked myself what purpose that served, and I asked the Department of Public Health, but they didn't really give me much of an answer, naturally. Or how about expanding the tourism investment of Connecticut? $1.4 million in new money to bring leaf peepers into our state for what they are calling full color Connecticut. My friend Amy brought that to my attention a few weeks ago, and I put it out on Facebook, and it got quite a response, and now everyone's repeating it. So good for her for digging that up as pure proof, plain and simple, that the governor doesn't believe we're in an emergency. Seriously, folks, how dumb does the governor think we are? How bold can he be? Stay safe, stay home. Or, come to Connecticut and look at our pretty leaves. I don't know if he's concerned about us infecting those visitors or them infecting us. But it's pretty clear he doesn't believe that it's an emergency. And of course, there's other fall festivals going on across the state. Thankfully, I was at the Durham Fair this past weekend, and I enjoyed myself thoroughly. The yard goats are still going. The mall's open. Concerts are taking place. As far as I know, you can still take a tour of the state capitol building. We are even taking in Afghan refugees. Would that be advisable in a state of public health emergency? I also have a laundry list of the governor's press releases just since July, but I have already spoken for quite some time. I don't want to get into all of these things, but suffice it to say, there's plenty of in-person bill signings without masks. There is encouragement for people to relocate to Connecticut. And of course, the governor couldn't help but take a shot at Texas, playing politics when he asked businesses in states that are restricting rights of women to consider relocating to Connecticut. You cannot have it both ways. You cannot both say we are doing so well and open for business and expanding tourism, etc., and then say we are in an emergency situation. By the way, you can also not claim that we are doing so well because of the policies put in place when there's little, if anything, making any real impact right now. As far as I know, there's only 2 significant policies in effect from the governor's emergency powers that are affecting COVID-19, and that is the mask mandates for schools and leaving it up to towns for mask mandates in municipal buildings. But I asked the question, what good is a mask mandate in town hall when people are largely unmasked everywhere else? I was in a traffic jam on the way here today. Have people been to restaurants? Have they been to the mall? Do they not know that there are people out there? I keep seeing the meme of college football stadiums filled to the gills and then a picture of a child 7 or 8 years old wearing a mask in a classroom. Masks in school, particularly for really young children, are a problem. I'm not going to deny that masks can prevent, the spraying of droplets and may have some effective possibility. But when you're putting them on small children, how effective can they really be? I talked to teachers who are telling me, that the kids got, snot and food and God knows what all over their masks. I've talked to parents who said that they write their name on the child's name on the mask, and then they come home wearing a different mask than the one they sent the kid to school with. And of course, I know teachers who've told me stories about, well, I'll give you one. I have a teacher friend who says that in her school, it is super strict. Like everybody's got to wear a mask all the time, everywhere. The teacher in the front of the classroom, every student, and they patrol the place like crazy until lunchtime. And then everybody goes into the cafeteria and it's just a complete free-for-all. So how effective could that possibly be? And I'm not saying that's happening in every school. I'm sure there are different schools that have different policies of varying degrees of effectiveness. The bottom line, though, is putting masks on kids is complicated. It cannot be done in a way that is legitimate. You can't provide for these kids to change their masks every time they touch them. You cannot teach them properly to wear proper masks and so forth. It's just problematic, and it's causing as many problems as it pretends to solve. And the bottom line is that the 2 mandates I mentioned are not making any significant difference in the results that we have in this state. I'd also recommend to anyone who really wants to know the truth about these things to look around the world. See what other countries have adopted for policies and what their results are. Ignore any opinion articles since they are made up and complete nonsense for the most part. Just look at what mandates they have and what their fatality rate is. And start by looking at us versus Sweden as a good example. The bottom line is that claiming we are doing so great because of the current strategy is a weak argument. Those 2 mandates, even if they were thought to be somewhat effective, they mean little when employed in the patchwork fashion that they are. I have said all along that if there is any credit to be given of how good we are doing, it belongs to the people themselves because of their conscious decisions to protect themselves and their families, not any politicians and not any of their un-American mandates. The real reason why I'm standing here, Madam President, is not so much everything that has happened, although I'm against all of that for sure and have been. But the reason why I'm putting so much effort into this and the reason why I am imploring my colleagues to listen to reason is because what really concerns me is what is coming next. Well, vaccine mandates for state employees began yesterday, but I don't know that we know the full extent of the damage that will cause. It is unnecessary, and frankly, it's gross. I'm hearing from countless constituents with emotional stories of how this mandate is going to impact them. And we have many, many hardworking state employees who are going to lose their jobs over this. Plenty of them are close to retirement. They are panicked. They feel helpless. I really cannot even describe the number of people that I've talked to and the very unbelievable stories that are hard to describe just how upset people are. We saw quite a few of those people come out last week to a kind of impromptu public hearing put on by the members of the Conservative Caucus. But there are thousands more who feel the same way, but they're living in fear and they are afraid to come forward. I want to thank Representative Fiorello for taking the time in the House yesterday to kind of go through a lot of those people who testified and tell their stories. And everyone here should go back and listen to that and understand that the decisions that we make and this decision today affects real people. Is that the legacy that you want? And the question is why? As we discussed already, we have very, very high vaccination rates. Governor says we have the highest in the whole country. I would argue that the hesitancy is being created by the heavy hand of policies of people like Governor Lamont and President Biden. If people were informed and believed that the vaccines were proven, key word, to be safe and effective, they would take them. The problem is that there are serious and growing questions about the safety and effectiveness each day. And using government force to mandate them is certain to undermine confidence and create resistance. It makes me wonder what the purpose really is. We established a few minutes ago just how statistically low the likelihood of someone, say 25 years old, is of succumbing to COVID-19. Remember 69,000 cases, I think it was, and 11 deaths since the beginning. And again, we don't know if these were healthy people, and I would bet they were not. So 11 deaths. So why are we putting so much pressure on people that are not particularly susceptible getting vaccinated? And seriously, why? The moment it became common knowledge that the vaccine does not prevent transmission, any argument for collectivism with regard to public health became undeniably moot at that very instant. There is discrimination and segregation happening in our state over this, ladies and gentlemen. State employees without vaccinations are actively being persecuted and forced from their jobs. Teachers also. Someone so inclined could go and look up lots of information and make some pretty interesting deductions about who the people involved are. One thing is for sure, it's not about science. I'm also hearing something extremely troubling, and that is the idea that religious exemptions for state employees will have to be approved. What does that mean? Our constitutionally protected rights are not to be determined or approved by any state agency or bureaucracy. This is just another example of how this administration continues to defy sacred concepts of what our American system stands for. In America, we value the rule of law, which is written down, it's clear, it applies to everyone the same way. But we are headed towards the rule of man, where you have bureaucrats and individual people being put in positions of authority to be deciders. That must stop here and now. And our religious freedom is not up to debate by any bureaucracy. Just like the Fifth Amendment, I refuse to answer on the grounds that I don't want to incriminate myself. No one can question that. You don't have to explain it, and you don't have to explain your religious beliefs either. You simply state that you are following your religious beliefs, and that is the end of that conversation. Questionnaires put out by the state demanding information about previous vaccinations and someone to write a statement proving that their religious beliefs are genuine are wrong, and I believe unconstitutional. The notion that the state must dictate our behavior is an insult to every citizen of Connecticut. We can and must make decisions for ourselves, especially our personal health decisions. And as Senator Kelly mentioned, this level of government control constitutes a dangerous precedent. Back in 2008, and I mentioned this in a video I did not too long ago, when the avian flu looked like it was going to be catastrophic, much like COVID did last February and March, the ACLU issued a very important statement. And I think it's so important that it bears repeating. Quote, "The lessons from history should be kept in mind whenever we are told by government officials that tough liberty-limiting actions are needed to protect us from dangerous diseases. Specifically, coercion and brute force are rarely necessary. In fact, they generally are counterproductive. They gratuitously breed public distrust and encourage the people who are most in need of care to evade public health authorities. On the other hand, effective preventive strategies that rely on voluntary participation do work." Wow, were they spot on or what? Again, bottom line, there is no emergency happening in the state of Connecticut right now. If the governor wants to do something good and constructive, I suggest that he works to ensure that all Connecticut residents receive the unbiased truth about what is really happening and what risks truly exist. It's unfortunate and sad to me that this information is not what is being put out by the administration and is not what is being reported largely in the news media. And the result has been a huge division in our society, stemming from the failure of this government to honor its commitment, its limited role in dispersing information for free citizens so they can make their own informed choices. Instead of informing citizens and educating them on their potential risks, we have seen a marketing campaign replete with fear-mongering, intimidation, fake science, and coercion. I beg of my fellow citizens who have fallen for what amounts to a con, the false notion that others are putting you at risk or that they are selfish if they are unvaccinated. That is behavior that is selfish and degrading. It is you who's treating the other person as if they have no value and their opinions are secondary to yours, and that their body is nothing more than a tool to reduce your own personal risk. It is this dangerous and collectivist anti-American view that is giving fuel to the fire that is engulfing our freedoms. Forcing another person, particularly children, to abide by one person's opinion of what is best for them, or even society at large, to the point of denying that person's own liberty to make their own choices, is and will always be wrong. Forced medical mandates are contrary to everything America stands for. I cannot make this point strongly enough, Madam President, since we are witnessing a remaking of our freedom-based society into one based in collectivism, fear, and hatred. And after this vaccine mandate, the next thing will be mandatory vaccines for school children, and then perhaps COVID passports. Let me make my position very clear. Vaccines are amazing things that have saved countless lives throughout history. No one can deny that. And I would encourage any at-risk person to go get one of the COVID-19 vaccines immediately if you haven't already. But at the same time, you should be also told the truth about the real benefits of the vaccine and the real risks of the vaccine. Not blind obedience and not a sales pitch coming from your government. Incidentally, for people who really want to see our vaccination rates go up, let me tell you that I know lots and lots of people who have not gotten the vaccine who are not anti-vaccine in the least. They simply want a shot that they trust to be safe and effective. They just don't have that trust. Serious question. This is for the governor and for anyone who's going to vote yes today. Why the mandates? If these things are so good, why not just convince people to do these things without the use of government force. I can think of few things, actually, that are as un-American, vile, and also unscientific as a universal medical mandate. Yes, unscientific. Since, as I mentioned, it's well known that individuals who have the vaccine can still get the virus and they can still transmit it. That also makes it clear that any policy put forth by the governor or anyone else that treats vaccinated people differently than unvaccinated people is not based in science. And probably is based in something much more sinister. Yesterday, one of the best speeches I heard on the House floor was from Representative Rabimbis. She was extremely eloquent, and one of the points she made so clearly was that if the vaccine works reliably to prevent catching or spreading the virus, then it shouldn't matter to a vaccinated person who else is vaccinated. And if the vaccine does not work reliably to prevent catching or spreading the virus, then who cares? Mandatory COVID-19 vaccines for school children. I'm sure everybody remembers the debate we had in this chamber and also in the House about removing the religious exemption for school kids. It was a passionate argument. There's no doubt about it. It'll be one of the things I remember long after I leave this place. But I remember many people who voted yes to remove the religious exemption who stated uncategorically that they would never, ever support mandating the COVID vaccine for school children. Please know that if you vote to give the governor this power today, you are voting for that to happen. I also wonder why we are ignoring the entire population of people with natural immunity as if they do not exist. I asked the Department of Public Health about this. I said, why aren't we talking about this? And they said simply that, well, everyone still falls into the category of vaccinated or unvaccinated. And forgive me, I know those people are just doing their jobs, but that is not an acceptable answer. Why push the vaccine for everyone, especially those people with natural immunity, since it is widely accepted that natural immunity is superior? And why is every policy coming from the governor and from our state health department ignoring other FDA-approved treatments? Why don't we hear more about this? Why isn't this as an option for everyone? I can't stress strongly enough the concern over this extension is giving the governor the power to create more forced medical mandates on the free citizens of this state. And as I said, forcing people, particularly people who, based on actual science, have an almost negligible chance of dying from COVID to get the vaccine or become outcasts in our society, unable to participate in commerce, travel, etc., that's pure evil. And we can see the roots of it growing already. This is probably the most important message I want people to hear today. If you do not have bodily autonomy, if you don't own your own body, and you are not free to make your own decisions how to treat it, then you are a slave. It's that simple. And that's not how things work in America. In America, we are free citizens, not subjects, and the government works for us. Remember, as Senator Kelly mentioned, right from the start, a government of, for, and by the people. More than that, each of us are kings and queens in our own right. That was the idea behind the founding of this great country. It's also why we are great and amazing and have accomplished so much. We make our own choices as free people. We own property. We have a government because we choose to. It's not our boss. And the legislature is where our representatives go and gather to represent us as individuals. The governor is not a king. In July, I reminded everyone that calling the governor a king, which is happening all over Connecticut, people are using that terminology, it's not something to be proud of. This country does not tolerate kings. If the government will now have the power to force someone to stick a needle in their arm and put chemicals in their body against their will, or even make a vaccine a condition to employment or receiving education, then we will have no rights at all. After all, what is next? What requirements will the governor put upon us in the future to be part of our society? Let me ask my fellow senators the same question I asked during the debate on removing the religious exemption for vaccines for school children. How many people in this legislature who plan to vote in favor of this extension and the mandates that come with it have personally uttered the words, "My body, my choice"? It's a simple question. Who owns our bodies anyway? Is it us? Is it the government? Is it our self-appointed monarch? Is it the governor himself? We have to think about how we want to live, ladies and gentlemen. Do we want to live in a free society where the government's job is to protect our right to live as we see fit, to pursue our own happiness, like the Declaration of Independence says, and we have the power as citizens to correct our course if we choose to? Or do we want a government that is the only thing that is truly free to do what it wants, and that the citizens have to beg for permission? Do we want a society where one man can mandate your bodily autonomy? Think about that for a second. I know many of my more progressive colleagues are enraged at the idea of males debating women's health or abortion. They must certainly recoil at the idea of one man making health choices for everyone. It all needs to end. Based on the facts I just shared, no one can deny that there's no public health emergency and that individual, local, and legislative powers must be restored. I have demonstrated using the state's own data that we are clearly not in a state of emergency. But ultimately, it's not my job to prove that there's no emergency. It's the governor's job to prove that there is. He cannot, because we simply are not. And absent this proof, every member of the state Senate must vote no. And regardless of how this vote goes today, I will continue calling on Governor Lamont to consult his conscience and immediately rescind these emergency powers. I believe a failure to do so is a violation of his obligation and a betrayal of his oath as the governor of our state. And make no mistake that every senator here, along with the representatives from yesterday who votes yes, is voting for every act that follows. More mandates, more abuses of power, COVID passports, all of it. I'm asking everyone out in the world listening who agrees to continue speaking up publicly through social media, on the radio, letters to the editor, newspapers, public meetings, whatever. I know so many people who are watching this continued abuse of power unfold in simple disbelief that it is happening in their country. I am one of them. I know many who are scared or feel trapped. They need to protect their income, their families, their children. Yes, they are genuinely terrified of their own government. And I know as a result, many will reluctantly comply. But we have to make our voices heard. If we allow the government to ignore our freedoms and constitutional protections because of an emergency, then the government will continue to create or extend emergencies so they can keep ignoring our freedoms and the Constitution. I tell people all the time when talking about this issue, this only ends when the people say it does. Complying or obeying tyrants does not stop their tyranny. Of course, I'm not suggesting anyone engages in violence or insurrection, but we have to speak up. We cannot tolerate this overreach. We should be respectful, but we should be firm. The truth is clear, and it is on our side, and it cannot be ignored or hidden indefinitely. It's time to end arbitrary one-man governance and restore the rule of law in Connecticut. And I have one final statement. The last thing I will say is to my fellow senators. I implore you once again, do the right thing. Everyone knows the public health emergency is over. The public knows it. The press knows it. It's time to reclaim your role. And more importantly, defend the rights of your constituents, not to be forced or controlled. Never in history have the people forcing others to comply been the good guys. Let's end it today. Thank you, Madam President.
Thank you, Senator Sampson. Will you remark further?